Hello, gentlemen. Welcome to Triple N Media. I am Nik Nikam. In this presentation, we're going to look at why Pfizer dropped GLP-1 weight loss pill by the name Danuglipron in April 2025. This was just reported on April 14th, 2025, and let's find out what was the reason. Pfizer halts GLP-1 weight loss pill after liver safety concerns. Danuglipron was discontinued following clinical trials setback. The GLP-1 agonists work primarily on the stomach by suppressing the appetite and decreasing the gastric emptying, so the stomach doesn't empty, decrease the motility and gastric acid secretion. It helps in weight loss. There are several other GLP-1 agonists which have been successfully launched in the market, which we will talk about in a minute. It also has effect on liver, brain, pancreas, muscle, and fat cells. In this particular case, it was related to the elevation of the liver enzymes that was of concern. That was the reason why Pfizer had to stop the research on Danuglipron. Key takeaways from this study was that Pfizer had to scrap this Danuglipron study as one patient showed elevated liver enzymes, and these elevated liver enzymes improved after discontinuation of the medication. This is the third obesity drug failure after lotiglipron in 2023 and twice daily Danuglipron in 2024. Pfizer lags behind Novo, Nordisk, Eli Lilly in the $150 billion GLP-1 market. There are already pills available from these other manufacturers that are being used for weight loss program. As I mentioned, this patient developed elevation of liver enzymes, which returned back to normal after discontinuation of the medication. The data was reviewed after FDA feedback. Pfizer decided to discontinue these clinical studies. In 2024, Pfizer had tried twice daily dose of Danuglipron, which was not successful, and they had to scrap the study. Pfizer has been having challenges in terms of bringing a oral GLP-1 drug, as its oral GLP-1 has failed 3 times now. Glucose-dependent insulinotropic polypeptide receptor. As I mentioned, the rivals have like semaglutide by Novo Nordisk, which goes by the name Wegovy or Ozempic, and Eli Lilly's drug oral GLP-1 agonist. Well, when it comes to GLP-1 weight loss pills, I think it is safety versus efficacy that is of a major concern. Elevated liver enzymes are found in other medications also, but not to the extent it was found with the Pfizer drug. One of the major side effects of this GLP-1 agonist is 73% of the patients experienced nausea. Pfizer claims that the incidence aligned with the approved drugs, but nonetheless, it discontinued the further research. Pfizer shares have been down 13.5% since April. Oral GLP-1 drugs are projected to hit $50 billion market by 2030. Pfizer is working on phase 2 trial of glucose-dependent insulinotropic polypeptide receptor, and it also has another oral GLP-1 candidate which is in phase 1 studies. But the main focus appears to be on safety. Ladies and gentlemen, you have been watching a presentation on Pfizer discontinuing GLP-1 weight loss pill Danuglipron on April 14, 2025. Thank you so much for watching this presentation. We will see you in the next presentation. Please do subscribe to our YouTube channel.